Hi, my name is Jane Maguire and I'm one of the community outreach midwives based at the Royal Bolton Hospital. Today I'm going to talk to you about how to safely put your baby to sleep every time it goes down for a nap or a longer sleep. The safest place to put your baby to sleep is either in a Moses basket, a crib or a cot. The use of a car seat, a bouncy cradle or a rocking cradle should be used to the bare minimum. When you're putting your baby down for a sleep, make sure that you put your baby in the feet to foot position, which basically means that you put your baby at the bottom of the crib with its feet resting at the bottom of the crib, the cot or the Moses basket. The bedding that should be used when you're putting your baby down for its sleep should only be either a cellular blanket or a fleece blanket. Do not be tempted to use any duvets or anything thicker than a blanket or a sheet. Careful consideration should be given to the number of layers of blankets you put on your baby when you put your baby down for a sleep. Whilst I have one blanket in front of me, if you fold it in half, you then have 2 layers. If you fold it again, you then have 4 layers. But you actually only have one blanket. So you should have a maximum of 2 layers put on your baby when you put it down for sleep. When you are discharged from hospital, you will be given one of these room temperature gauges. The ideal temperature to have your room at is between 16 and 20 degrees. During your pregnancy, your midwife will talk to you about safe sleeping. They will show you visual aids of a bad room and a good room. The bad room, which is the first one we will concentrate on, illustrates that the baby is in the room on its own. Baby should be roomed in with its parents for up to 6 months. It will also show you the use of too many blankets, a pillow, baby's toys in the cot and a baby wearing a hat. There is also alcohol in the room, cigarettes, a pussycat, and the cot is placed very close to the radiator. There are also additional risks of books on the windowsill and also a picture on the wall. These are all things that could fall onto your baby into the cot. The good room picture that you will be shown will show an ideal place for a baby to be in its parents' room. It will be situated in its cot or its crib alongside the parents' bed with a temperature gauge that I showed you earlier on the side of the cot. You will also see that there are no cigarettes, no alcohol, no pets, nothing on the wall that would fall on the baby. The baby is positioned in the feet to foot rule with a maximum of 2 blankets on its back with no pillows or toys in the cot with it. Another effective way that's been proven to reduce your risk of sudden infant death syndrome is by breastfeeding your baby for as long as you possibly can.